Hi, my name is Johannes Takalabra. Today I'm going to explain how you give for the patient incentive spirometer. Before you enter any patient room or anything, first you do sanitizing your hands and wait until you get dry, and then after that check the the physician prescription and chart everything like and then check the what kind of treatment he need and what kind of material you need before you enter the patient room, and medication everything you collect and you went to the patient room. So before you enter the patient room, you knock the door and check and tell them and you go inside and you sanitizing yourself and you ask them what their name and check the wristband and make sure it was the right person. After the right person, then you tell them why you came today for and what kind of treatment you're doing for him, and um, make sure ask them like is that allowed to give is that okay if you give them the this kind of therapy, and ask his family or his relative and make sure if they are all right uh, to get that treatment. So when you start the IS, that means incentive spirometer, the first thing you do, you evaluating your patient ability. It means that how he generate the capacity, vital capacity of at least maybe he should have like 10 milliliter of kilogram or greater than 30% of predict normals. So make sure everything here, the diaphragmatic hernia, and measure the pulse rate. It means like vital sign, everything. You check respiratory rate, access the color level, like the skin color, and then after that you access the patient like the development atlases, or and then review the X-ray, and yeah, you depend on the how what kind of the like you check the X-ray and check the what he have the atlases, and assess the breath sound and not advantageous lobe or something. So you just check his like what kind of he got his and after that you determine the target volume of the achievement. Like you should have a target like what how much you want it, and then yeah, and you start maintaining the thing, the mouthpiece, peak flow, everything. You start assembling the machineries to the thing like the treatment thing, and before you give them, and make sure how the like the right way you the device you act the patient tube the most, you assembling how the right way you assembling, and you evaluate the proper function. Then after that, instruct the patient how to use the device. So you should tell them like a nice way and clear way, and with a good language, tell them how you use this device effectively. So every time you make sure it works effectively or not, you should check the leak, everything they have a leak or anything. So you should check the patient technique, how he provides the proper feedback. So you should check how the patient technique, then readjust the volume or the flow goals, like depend on how the patient doing good or doing bad. So you should adjust the flow, and instruct the patient perform a minimum 5 to 10 sustained maximal inspiration. So um, the patient that's the thing. Then after that, after that you should have the follow-up. So uh, because you have record before the treatment, and so you should have a record after the treatment, because we should know, like, how every time we give a patient any therapy, you should have a goal. So our goal, like, you see that, like, you check everything, the vital sign, you check the breath sound, everything. Because you should check everything. Then after you finish the treatment, so after you finish the treatment, you just rub your hand, everything, by sanitizing, clean the area by alcohol. So that's how we do it, the treatment.